Precautions. There are no precautions. Knock knock. Hi there. My name is Ty, and I'll be your student nurse today. And I'm gonna provide privacy. I'm gonna set my clean towel down, and then I'm going to don clean gloves. Before I do that, may I have your full name and birthday? Okay.
Mrs. Smith, 12/16/75.
Wonderful. Mrs. Smith, today we are going to do a wound dressing change. Okay. Do you have any allergies?
Nope, no allergies.
Okay. And I checked the provider's order. I'd get everything I needed. Are you in any pain?
No, I'm not in any pain.
Okay, great. And then if she was in pain, I would administer the pain medication 30 minutes prior, or do non-pharmacological interventions like relaxation and breathing. All right, before we get started, I'm going to first I'm going to sterilize. And before I do that, I'm just going to raise the bed to a comfortable position and make sure she's comfortable. Are you comfortable, Mrs. Smith?
I'm just fine, thanks.
Wonderful. I'm going to reach over now, but after I sterilize it, I can't reach anymore over the sterile film. Okay. Wonderful. Okay. Now I'm going to set my clean towel so I can place my bio bag. And then I'm going to set my sterile gloves over here too, just because I don't want to reach over. All right. Okay. Now I'm going to expose the client.
Yeah, she did the label. It's the label. Like during the bowl. So you can
label
I have
one.
mine pre-labeled, and then I would just label it with another one.
I'm gonna go potty too.
And just to let you know, for filming purposes, I do put one of these gloves in the sterile, for the sterile gloves because they're too small for me. I'm going to cover the client, uncover the client. All right, uncovering only what's necessary. And then I am going to hold the skin tight, and I'm going to pull gently but firmly away from myself and away from the client. All right. And then I'm gonna check for color, type of infection, amount, odor, peritoneal drainage, a consistency. Okay, looks clear. I'm gonna chart that. And then I'm also going to grab the rest of these gauze and also checking around that to assess the drainage again, the wound, color, consistency, and that looks pretty clear. So it looks pretty clean and healing well. And then I'm going to notice also on the wound if there's any swelling and redness, any infection, blood, any anything unusual. I'm also going to chart that, and then now I'm going to measure my wound. Okay. All right, so not to touch the edges of the skin. So it's 2.5 inch. The width, 3 inch, and the length, 12 inch. Okay, we are going to go ahead and chart that, or write that down, then we'll chart it later. Okay, now I'm going to set my sterile fill. Okay, hold out gently. And I'm actually going to be extra clean and put on another pair of gloves. Okay, so again, the arms are above, okay, not facing away from the sterile food or the client. And so I'm going to, I pull that out. So earlier I was supposed to, I'm supposed to dump this out right now. So now I'm gonna. This was supposed to be on top, that's what I meant. So, okay, so, never mind, I touched that, okay? I'm supposed to not touch the edges. There we go. All right, over 1 inch. There we go. And then I'm going to set the sterile field like that, making sure it's stable. Okay, and now I'm going to dump the sterile field out. And grab the solution and making sure that I'm not touching anything else. Being careful. Not to touch the edges.
Do you remove
So that I have not touched the top. Again, arms above the table, still facing the client. Okay, now I'm gonna don my sterile gloves. Like again, for filming purposes, I use the blue gloves because they're too small. The sterile gloves are too small.
And then I fold it like that, and then I take another pen and
Yeah,
that's how I fold it.
yeah. I was practicing on Friday and I
Okay,
I
so
hold
I'm
the
going
bottom
to.
and hold the top.
With one hand. I see.
Only touch, sorry. It was folded in the wrong way, so I'm just gonna only touch the inside. Pulling only from the inside, not touching the outside. Stay still on the inside. Again, away from my sterile field. Okay. And now I'm going to it's difficult, but I'm going to insert from this way.
Do a close-up shot.
And so it's still sterile. Okay, now I am going
I
to
just did it in the middle.
use my sterile glove to wet the gauze.
She has a different safety mechanism.
Okay.
That's why I ripped mine to get it.
I'm going to rinse it out dry. And then I'm going to grab this and pack my wound. And if there was any like wetness from the wound, I would dry it off and use Barrow cream. So I'm gonna take this out
Do we want to just go straight
and pack the
forward
wound.
and go? Or do we want to practice? I know I need to practice.
Okay, so it's dry, and I'm gonna slowly pack the wound tight.
Yeah, might as well.
And
So you go first since, yeah. You go
all right,
first, 'cause we can learn from you.
there we are.
I haven't practiced at all. I hope you know I really and truly am.
And then I'm going to
I actually need a real band-aid because I have awful.
put the bandages over
Oh, you need a real
I got pressure one.
over 1 inch from the wound.
Band-aids.
I'm just gonna
Nice,
go get
tight,
tape
neat.
with my bandage.
Are you still in any pain?
Nope, I'm fine.
And earlier I forgot to check the allergies. I need to check her allergies, yeah. And she had no allergies. All right, all right. And then now, again, not reaching over the sterile field, grabbing this and putting this pad on with the blue line up. All right. Hey. And then I'm going to sanitize first. Okay. Tape.
Is that all right?
Okay. Now I'm gonna label this a name, date, and time, and I would tape that also. All right. Now I'm going to cover the patient for privacy. Okay.
Maybe I'll go this way so I don't mess up everyone's chairs.
All right, Mrs. Smith. Do you have everything you have here? All your possessions? You need a good potty?
Nope,
Are
I'm
you
fine.
Great. Are you in any pain?
No pain.
Is there anything that you need?
Nope.
No? Okay, I'm gonna lower the bed, lock the bed, and then provide the call light. Okay? And then I'm just going to clean and put away my supplies. Okay, so the biohazard stuff goes in the biohazard, and the regular trash goes in the regular trash. Okay. And then I'm going to start to leave the room, making sure that I will be charting if the pain, how she tolerated the pain, Again, I need information about the wound, the drainage, the colors, consistency, the edges, and any additional thing care that I provided. And I'm gonna chart, and then I did the call lights already, and now I'm gonna leave the room, and I'm gonna uncover the covers and then chart everything.